Is morphine a lifeline or a death sentence in hospice care? This question is not just a matter of debate for healthcare professionals, but is also a growing concern among family members and caregivers. The controversy surrounding this potent painkiller, morphine, is intriguing, complex, and full of contrasting views. Morphine, for those who don't know, is an opioid pain medication. It's one of the most effective drugs for severe pain management, making it invaluable in hospice settings. When a patient's pain escalates to unbearable levels, morphine has the potential to provide a significant relief, improving the quality of life in their final days. It can ease breathing difficulties, calm anxiety, and help patients to rest comfortably. However, it's not all sunshine and rainbows with morphine. The drug carries a heavy weight of controversy due to its potential for addiction and its side effects, which can be severe. Overdose can lead to shallow breathing, slow heartbeat, severe drowsiness, or even death. Moreover, the stigma attached to morphine, often linked with illicit drug use, makes its role in hospice care a subject of intense debate. Morphine's use in end-of-life care is often misunderstood. Some perceive it as a means to hasten death, a shortcut to the inevitable, creating a cloud of fear and suspicion around its use. But is it truly the Grim Reaper's ally, or is it a compassionate tool in the hands of healthcare professionals, aiming to ease the suffering of those in their twilight hours? The answer is not black and white, and it is this ambiguity that makes the topic so controversial. The key lies in understanding the medical basis of morphine, its proper administration, and careful monitoring. So let's strip away the stigma, dispel the myths, and look into the heart of the matter. To understand morphine's role in hospice care, we delve into its medical basis. What happens when morphine enters the body? That's a question that's been asked and answered by medical professionals for centuries. Morphine is a powerful opioid, a class of drugs that includes natural substances like codeine and synthetic ones such as fentanyl. All opioids work by interacting with specific proteins, called opioid receptors, on the surfaces of cells. These receptors are found in many areas of the body, but they're especially concentrated in the brain and spinal cord. When morphine reaches these receptors, it essentially flips a switch, causing a cascade of biochemical reactions. The end result? Pain signals are dampened, and a sense of relief floods over the body. This is why morphine is such a vital tool in pain management, particularly in hospice settings. But it's not just about pain. Morphine also affects other parts of the body. It can slow breathing and heart rate, and it can cause feelings of relaxation and sleepiness. These effects can be beneficial, but they can also lead to complications if not properly managed. So, why morphine? Why not another drug? Well, morphine has a long history of use and a well-established safety profile. It's been used for hundreds of years to alleviate severe pain, and we've learned a lot about how to use it safely. Plus, it's highly effective. For many patients, morphine provides relief when other medications fail. But it's not a one-size-fits-all solution. Everyone responds to morphine differently. Some people may need higher doses to achieve the same level of pain relief. Others may experience side effects more intensely. That's why it's critical to tailor the use of morphine to each individual patient's needs and responses. Remember, morphine is a powerful tool. It can bring immense relief to those in pain, but like any tool, it must be used with care, respect, and a deep understanding of its effects on the body. Now that we understand morphine's workings, we turn to its safe usage. Hear from Dr. Smith, a renowned pain management expert on safe morphine use. Dr. Smith, with his extensive experience in pain management, is a wellspring of knowledge when it comes to the safe administration of morphine. He begins by emphasizing the necessity of a tailored approach. Every patient is unique, he reminds us, and so should be their pain management plan. There's no one-size-fits-all dosage for morphine. Dr. Smith then delves into the importance of dose regulation. Morphine, like any other powerful drug, should be administered with caution, he states. Starting with a low dose and gradually increasing, it allows us to find the minimum effective dosage that alleviates the patient's pain without causing undue side effects. He further adds that the frequency of administration should also be closely monitored. Morphine has a relatively short half-life, he explains, so it needs to be given at regular intervals to maintain its effect. But it's critical to avoid overdosing, so regular monitoring of the patient's pain level and response to the medication is crucial. Dr. Smith also highlights the importance of monitoring for side effects. While morphine is an effective pain reliever, it's not without its potential complications, he warns. Side effects can range from mild, like constipation and drowsiness, to severe, such as respiratory depression. Hence, it's vital to keep a close watch on patients and adjust the dosage or switch to a different medication if necessary. Finally, Dr. Smith underscores the role of clear communication in administering morphine safely. Effective pain management is a team effort, he says. It requires the active participation of doctors, nurses, other healthcare professionals, and the patients themselves. Open dialogue about the patient's pain levels, their responses to the medication, and any side effects they may be experiencing is integral to ensuring that morphine is used safely and effectively. As Dr. Smith highlighted, monitoring is crucial in morphine administration. How do hospice nurses ensure safe morphine use? It's a question that underscores the critical role these healthcare professionals play in end-of-life care. Hospice nurses are the backbone of morphine administration in hospice settings. They are the ones who carefully measure the dose, administer the medication, and monitor the patient's response. But their role extends far beyond this. They are also responsible for assessing the patient's pain levels, evaluating their comfort, and adjusting the dosage as needed. This isn't a skill they develop overnight. Hospice nurses undergo extensive training to ensure they're equipped with the knowledge and skills necessary to handle powerful pain medication like morphine. They learn how to recognize the signs of both underdosing and overdosing, understanding that both can have serious, even life-threatening consequences. Their training also emphasizes the importance of communication. They are taught to listen to their patients, to understand their fears and concerns, and to reassure them about the safety and necessity of morphine in managing their pain. It's a delicate balance, one that requires both empathy and expertise. Monitoring the patient is an ongoing process that requires vigilance and attention to detail. Hospice nurses observe their patients closely for signs of discomfort or distress, changes in breathing, or any other indication that the medication may not be working as intended. They are also alert to the potential side effects of morphine, which can range from nausea and constipation to confusion and hallucinations. Hospice nurses are also the link between the patient, their family, and the rest of the healthcare team. They ensure that everyone involved in the patient's care understands the treatment plan, the role of morphine, and the signs to watch out for. Hospice nurses play a vital role in safe morphine administration. But what about the patient's role? As we move forward, we'll see how patient autonomy and education come into play in this complex and sensitive process. How much control should patients have over their morphine use? A question as layered as it is critical. As we navigate through the complex world of morphine use in hospice settings, it's important to understand the weight of patient autonomy and education. Patient autonomy is a cornerstone of modern medical ethics. It is the principle that individuals have the right to make decisions about their own bodies and health. In the context of morphine use, this means patients should have a say in their pain management plan and how morphine is used as part of that. However, autonomy shouldn't be mistaken for uncontrolled self-medication. It's about being an active participant in the decision-making process, having your voice heard, and your concerns addressed. Autonomy is a two-way street, and it requires open communication between the patient and the healthcare team. That's where education comes in. Knowledge is power, as the saying goes, and in this case, it is a means to ensure safe morphine use. Patients should be informed about the nature of morphine, its benefits, potential side effects, and the importance of following the prescribed plan. To provide some insight on this aspect, let's hear from a medical ethicist. Education empowers patients, they say. It alleviates fears and misconceptions about morphine use. Moreover, it enables patients to make well-informed decisions about their treatment, fostering a sense of control and participation. But it's not just about patient education. Healthcare professionals need to be educated too. They need to understand the importance of respecting patient autonomy, acknowledging their experiences, and providing them with comprehensive and comprehensible information. In essence, patient autonomy and education are intertwined. Together, they form a symbiotic relationship that promotes safe and effective morphine use in hospice settings. Each patient is unique, and their pain management plan should reflect that individuality. Patient autonomy is crucial, but it must be balanced with medical expertise. It's about striking the right balance, a balance that respects the patient's rights, values their input, and prioritizes their well-being. It's about creating a partnership in care, one that is built on trust, mutual respect, and a shared commitment to the patient's comfort and dignity. Dr. Jones, a palliative care specialist, shares her views on balancing patient autonomy and medical expertise. With the complexities of palliative care, this balance is often a delicate dance, particularly when it comes to morphine administration in a hospice setting. Dr. Jones begins by explaining that patient autonomy is a cornerstone of her practice. She believes that patients should have a say in their care, particularly when it comes to managing their pain. She firmly asserts that patient education is essential in this process. It's about providing patients with the knowledge they need to make informed decisions. She emphasizes the importance of explaining the benefits and risks of morphine use and ensuring that patients understand their options. However, Dr. Jones also acknowledges the critical role of medical expertise in ensuring safe morphine use. She highlights that morphine, while a powerful and effective tool for pain management, is not without its risks. Overdose, dependency, and side effects like constipation and nausea can occur if not properly managed. She explains that as a palliative care specialist, it's her responsibility to monitor morphine usage and adjust dosages as necessary. She employs a team-based approach, working closely with nurses, pharmacists, and other healthcare professionals to manage and monitor patients' pain levels and responses to the medication. Dr. Jones also touches on the importance of communication, not just with patients, but also with their families. She believes that involving families in the decision-making process can help ensure that everyone understands the plan of care and the role of morphine in managing pain. In closing, Dr. Jones reiterates her commitment to both patient autonomy and medical safety. She acknowledges that it can sometimes be a tightrope walk, managing the wishes of patients while ensuring their safety. But she affirms that it's a walk she's willing to take, day after day, for the sake of her patients. Balancing patient wishes and medical safety is a delicate act. And as we learn from Dr. Jones, it's an act that requires expertise, communication, and a deep respect for patient autonomy. What should we remember about morphine use in hospice settings? As we reach the end of our exploration, let's take a moment to distill the essential points we've discussed about the use of morphine in hospice settings. The first thing to keep in mind is that morphine, though controversial for some, is a crucial tool in the management of pain and discomfort in end-of-life care. It's a potent opioid, and when administered correctly, it can bring immense relief to those suffering. Next, we delved into the medical basis of morphine, understanding how it works in our bodies to alleviate pain. It's vital to recognize that morphine isn't a one-size-fits-all solution. Its dosage must be carefully tailored to the individual patient's needs and condition, which is where our healthcare professionals step in. We've heard from a pain management expert and a palliative care specialist who've both underscored the essential role of healthcare professionals in this process. They're not just the hands that administer the medication, but the brains that determine the right dosage, the eyes that monitor for adverse reactions, and the hearts that empathize with the patient's experience. Their expertise and vigilance are foundational to the safe use of morphine in hospice care. And let's not forget the crucial element of patient autonomy and education. Patients and their families need to be well informed about their choices, including the use of morphine. They should understand its benefits and potential risks, and feel empowered to participate in decision-making about their care. In summary, the safe use of morphine in a hospice setting is a delicate balancing act. It requires a deep understanding of the medication, a team of dedicated healthcare professionals, and informed patients who are active participants in their care. It's a complex issue indeed, but by shedding light on it, we hope to promote better practices and ultimately, better patient care. Safe morphine use in hospice care is a complex issue, but one we must understand to ensure the best patient care.